What we need is not more medication, but more education, because the best prescription is knowledge. This is Exposé coming to you live from Lagos, Nigeria, every Monday on Instagram, YouTube, and Facebook simultaneously. I'm the regular host, Tony Akinyemi. Don't forget, what we need is not more medication, but more education, because the best prescription is knowledge. Hello and welcome to Exposé with Tony Akinyemi. I'm honored to always be your host on this program. Lately, we've been dealing with medical gases or therapeutic gases. And we have zeroed in on three of those gases in particular: hydrogen, oxygen, and ozone. We have had some very meaningful theoretical discussions, as it were, on these gases. We have looked at their medical applications. We have looked at the benefits derivable from their deployment. And I promised you I'll be bringing practitioners, clinicians, experts, those who are actually doing it clinically. I am just a health educator. I call myself a health enthusiast, but they are practitioners. They are clinicians. They are the people that use these things day in, day out, who can attest to their effectiveness and their usefulness. I promise I'll be bringing you such people. In the last few episodes, I interviewed Dr. John Toagbiye from Abuja, Nigeria, and he was very, very explicit and elaborate in explaining the benefits of ozone therapy as well as oxygen therapy. And today we have yet another clinician, another expert, an MD, a medical doctor in the house, who also is very versatile in the use of hydrogen as a medical gas. We are honored to have Dr. Sam Asomugha in the house today to have this discussion on hydrogen therapy. We will meet him very shortly. He will introduce himself. He will tell us about his background, his training, his experience, and then a little bit about his clinic in Lagos, Nigeria, where he practices. And then, of course, we will dive into hydrogen therapy proper. I have a number of questions that I want to ask him today, and we want him to shed light on some of these things to help our understanding and how we can benefit from hydrogen therapy. So it's my honor to introduce to you today Dr. Sam Asomugha. You're welcome, sir.
Thank you, and I'm honored to be here.
It's an honor to have you. We're glad that you could create this time for us to be with us. Exposé comes up, 8 p.m. Nigerian time every Monday. And we have quite a number of viewers that love this program because this is where we share information, particularly wellness information for people's health transformation. We say to people, to be informed is to be transformed. Amen. To be uninformed is to be deformed. I would say what we need is not more medication, but more education.
Exactly.
For the best prescription is knowledge.
That's true.
And we are honored to have you to come and share your knowledge with us on this particular subject, which we believe you are a guru when it comes to this.
Thank you very
welcome,
much.
sir.
Thank you. Thank you.
So as we start, we'd like you to tell us a bit about yourself. Our viewers would like to know, who is Dr. Sam Asomugha? Where did you train? What kind of training did you get? Are you a naturopath? Are you an osteopath? Are you an allopathic doctor? Are you a chiropractor? What are you? What kind of training? What kind of experience, background do you have in the health industry?
Okay. Thank you very much. Once again, it's such an honor to be here. I've heard so much about Exposé, and I really want to thank you for the great job that you have been doing.
Thank you, sir.
Educating people, because like you said, education is the key.
That's right.
Yeah, ignorance is the worst thing that could happen to anyone.
Absolutely.
In fact, I have a personal slogan. I say that the worst disease in the world is not what medical doctors tell us,
right?
But rather a curable disease of ignorance. So, because when you know, more than half of the job is done.
Wow.
Especially in the area of health. Okay, now coming back to me.
Right.
Yes, my name is Sam Asomugha. I am a medical doctor, and I was educated for the medical profession at the University of Ibadan.
You are the premier university.
Yes. So we went through the preclinical school at the university, and then went to the UCH, the popular UCH, University College Hospital, for the clinical training.
You know, the UCH used to be one of the topmost 5 teaching hospitals in the Commonwealth of Nations.
That's
years
true.
ago.
Yes,
one of the top 5.
Yes.
In those days.
Yeah, up till the time that we were in the medical school, I remember very well that a good number of the professors that were there were listed in the who is who in medicine.
Wow.
Yeah.
I remember that when I was in high school, one of my teachers was an Indian lady. And then her husband actually had a medical condition. And they traveled back to India for treatment. And from India, they actually told them, you are coming from Nigeria and you came to India. You should have gone to UCH. They actually referred them back to UCH from India.
That's it.
I'm talking about the late 1970s.
Exactly.
They referred them back to UCH.
That's true. I mean, I'm not surprised at that. I mean, because we had professors that were well recognized in their fields. I mean, one of the surgeons, in our time, made contributions in the most popular book of in surgery.
Right.
Okay. And then there was another one that was best known for thyroid surgery, Professor Lurie. I mean, when he performs a thyroid surgery, I mean, you can, I mean, you are sure that you are good to go.
Right.
So there were so many of them in those days that we enjoyed the benefit of learning under their guidance. Yes, even as undergraduates, you were being well trained.
Right.
So we got one of the best backgrounds. And of course, I left medical school in 1983. That's about 39 years ago.
Almost 4 decades.
Yeah.
What an experience.
It's been a little time.
Right.
And of course, leaving medical school with the background of the knowledge we have, I was so inclined that we were going to deliver.
Right.
But 13 years down the line, I had a lot of questions regarding the medical practice. Because some of the things we felt we were going to see, we didn't quite, experience some of them.
Your experience was different from
beginning to be
what
different.
you anticipated.
Yes.
Okay.
Yeah. And being one of those with inquisitive minds, I began to query a number of things. Those days we were told, of course, that some chronic degenerative diseases like hypertension, diabetes, and the rest of them were not curable.
But they can be managed.
They can be managed. You will be on medications for life.
Right.
But along the line, we began to question some of those things because we felt that the medical profession is there to deliver, to help people get out of these problems.
Not to marry them for life.
Exactly. So I remember very well late in 1996, that's exactly 13 years after, I took a personal decision. And I said I was going to quit medical practice.
Quit medical practice?
Yes.
Wow.
To go look for answers for people. It was a very weird decision. But I remember the man I was working with at that time kind of, looked at me and thought maybe something was going wrong.
Maybe you need some examination.
But my mind was made up.
Right.
So I disengaged from working with him and went home. Well, because of the background of my faith as a Christian, I went on praying and asking God if is it that there is no other way people could be helped, medically. And it was in that process, took a little while, and I received some, inspiration.
Right.
Well, that's the way to put it to people to understand. Yeah. So, and I began to learn that there could be some other way to deliver health. And so we, just to cut the long story short, and I heard about a lady whom I had helped medically. She read biochemistry, and she had also quit her job and opened a shop where she sells supplements.
Okay.
So I went to pay her a visit, and it was there she gave me a book in nutritional medicine. And I went home reading that book. And that was the beginning of the change.
What's the title of the book? Is that the one by Phillips Bach?
Yes, Phillips Bach. Prescription for Nutritional Healing.
That's right. I got a copy of that in my library.
Exactly. I've got several copies.
Right. I've given her copies too.
Yes. So I read that book. I mean, I devoured it. Of course, if you come from medical school, reading books is nothing to you. So, so I was really moved by the things I saw in the book. And that was how the conversion came. Of course, to pick it, there's a way God works.
Yeah.
Just about that same time, my wife had a medical situation that required emergency surgery.
Yeah.
And after the surgery, she was very sick. In fact, nobody believed she was going to recover.
Wow.
The surgery wound would not heal. And her health was just going downhill. All kinds of, health, specialists were called to look into her case, and nothing could be done. So I was just left with her. She can't get up from the bed. I mean, she can't feed herself.
Physician, heal your wife.
Exactly. So there I was. She was. My mother-in-law had to come at that time to help, to take care of her. But it was just about that same time a couple visited us because they heard of the ailment.
Right.
And then and they come again talking about supplements that it could help. And of course, at that point,
you were ready for anything.
I was ready for anything.
Anything legitimate.
Exactly. So quickly, I went out to where they told me and purchased 3 nutritional supplements. And to the glory of God, I must say, in the first 1 week, I saw the first change. I couldn't believe it. By the end of the second week, my wife could get up from the bed and go have a shower. And then by the end of the third week, I went out. I remember that day very well. I went out. I don't remember where I went to, but on coming back, my wife was not at home.
Where did she go to?
I said, where is my wife? And they said she decided to take a walk.
Take a walk?
And I said, now, that's something I don't know.
Healing has happened.
Exactly. Anyway, so again, to cut the long story short, that's when I knew I need to take a change.
So you read the book, that was the theoretical part.
Yes.
And then your wife's case was the practical part.
Exactly. So
right.
From then on, I went back to the book and then, really taught the book.
That book is really fantastic.
Very fantastic.
I mean, I've read it and read it and read it.
I recommend it. And the book is available to both physicians and to, ordinary people. Anybody can read
Prescription for nutritional healing.
Yes.
Yeah.
Anyway, so that's where it started. And shortly after that, I met a man who was selling a peculiar nutritional supplement.
Yeah.
From Canada in those days.
Okay.
It was called Matol.
Right.
Matol was a wonderful supplement. I don't know why it's probably no longer available. And then I began to prescribe Matol, and we saw some unusual things happen, with people. But then soon after that, we now started doing much more wider things. So that's actually how we started, and this started in 1998. That's when I was trying to find my feet,
Right,
of course,
right.
not knowing any much, and then not knowing who to go to learn from.
It's 24 years now.
Exactly.
So
And,
you must have gathered a lot of experience along the way.
a whole lot now. And of course, in those days, almost like being a lone voice.
Yeah.
There were a lot of jeering and
I can
mockery,
imagine.
and
I can imagine.
from colleagues, family, friends, and all that. So it wasn't quite easy. But because of what I saw,
Right.
and what I had read, and of course what I believe God ministered to me.
So it was a tripod, so to speak.
Exactly.
The inspiration from God.
God, yeah.
The encounter with the book.
Exactly.
And then your wife's experience.
Exactly.
I mean,
yeah.
You
couldn't beat that.
Out of the mouth of 2 or 3 witnesses, everything is established.
Exactly. So,
I experienced similar sentiments when I began to talk about healthy living and wellness and what have you. I'm a pastor.
Yes.
I trained first of all as an engineer and then as a theologian.
Yes.
And now I'm talking health, and people wondered, what's your qualification?
Exactly.
How come? How are you changing lanes and running on another man's lane? I said, you will run into trouble soon. You will mislead people.
Oh my
In
God.
fact, some people said I have abandoned the Bible. I was now teaching biology. I heard all kinds of criticism, all kinds of attacks, all kinds of, very uncanny comments and what have you. But because I knew precisely what God had told me and what he had inspired me to do,
exactly.
I was undaunted.
Exactly.
I continued. And down the road, some of those who expressed reservations are now patronizing.
That's exactly how it happened. One of my biggest critics in those days, a sister-in-law, at some point she had to come to my practice now. And we spent almost like $500,000 taking care of her free of charge.
Can you imagine?
And by the time we finished,
she
she said for the first time she has had a medical attention.
Thank God.
We're happy to do that,
Okay, so we are happy to meet you, Doc.
Yes.
We're happy to know your background. We're happy to know your experience and your journey.
Yes.
In wellness, with a background in allopathic medicine as an MD, and then out of divine inspiration, out of encounters that have reshaped your worldview when it came to clinical practice and healthcare delivery. Now, so I would say, if I'm wrong, correct me, that you are now an integrative physician.
That's exactly what I am.
Functional medicine.
A functional medicine practitioner.
All right.
An integrative physician.
Right, good.
Yeah.
So we'll go on a short break now. And when we come back, we will now dive into hydrogen therapy proper.
Okay.
Now, I'll be asking you a catalog of questions on hydrogen therapy to help validate, as it were, some of the theoretical things that I have shared in previous episodes on the Exposé.
Yes.
So don't go away. We are going to be back very shortly after this short break, and we will take on Dr. Sam Asomugha on hydrogen therapy.
Discover fundamental truth that will transform your health and empower you to live a life void of sicknesses in this new book by Reverend Tony Akinyemi, Nature vs. Nurture. Get a copy to experience it for yourself. Please visit TSS Bookshop now to grab a copy. Have you been through stuffs and you survived? Guess what? It's time to set your world on fire. You never know who needs your light, your warmth, and courage. You are a survivor, and that's amazing. I Am a Survivor is Reverend Tony Akinyemi's newest book. Hurry now, grab a copy from the TSS bookstore.
Welcome back. This is still Exposé with Tony Akinyemi, where we give wellness information for your health transformation. What we need is not more medication, but more education. For the best prescription is knowledge. We have on set today Dr. Sam Asomugha, who is a medical doctor, an integrative medicine practitioner, a functional medicine practitioner, who integrates his knowledge and background training in orthodox medicine with his experience in alternative protocols. He deploys quite a number of alternative protocols as an integrative physician, but today we'll be zeroing in on just one main one. Maybe along the way we can touch on a few others, but the main one we want to focus on is hydrogen therapy. So Dr. Sam, what exactly is hydrogen therapy?
Okay. Well, just for benefit of those, some of us who had chemistry background in the O level will remember that there is an element called hydrogen.
Yeah.
And it happens to be a gas. And interestingly, hydrogen happens to be one of the simplest elements. If you remember what is called the periodic
table, that's right.
Hydrogen occupies the topmost, because it is a very light. Yeah, it's very light. And then over the years, when we were in medical school, going back again, all that we knew about was surgery, pharmaceutical drugs, and all that, but then medicine has evolved over the years. And especially those who have found themselves in what people call the alternative, which I do not believe.
Somebody actually said, what we call the alternative is the real one.
The real thing.
And the orthodox one should be the alternative.
That is the truth. Okay, so in the alternative medicine, a lot of research has been going on. And a lot of the things that were previously ignored or not thought to have medical benefits are now being found to have tremendous benefits. And some of them are the gases. Okay, I'm happy to hear that someone has spoken about the ozone and oxygen gas.
That's right,
okay.
Dr. John.
Yes, the hydrogen therapy is a type of therapy where the hydrogen gas is employed, okay, in effecting changes in the body. Okay, and it's being found now. A lot of research has been going on, especially since someone came out with one of the first research in 1987, thereabouts. Much more research has been going on, and a lot of benefits are being found with application of hydrogen as a form of therapy. I'm sure along the line we'll
talk about the various areas where it can benefit. Okay, how is that gas, hydrogen, how is it applied?
Okay.
For therapeutic effects? Or maybe other effects, prophylactic effect, anti-aging effect?
Yes.
Whatever.
It has so many of those benefits. Now, they've developed a machine that can generate the hydrogen gas. So it comes out as a gas. And it can be inhaled. And in fact, you might not believe it, some experiment that was done with divers. They
Those
found
who dive deep into the ocean.
Yes. They found out that hydrogen was able to sustain them much more than oxygen, diving very deep. That gives you an idea of what hydrogen can do, because down there, deep in the ocean, the pressure is, is something unthinkable. So they found out that inhaling hydrogen as a gas could do a whole lot of things in the body. Then also infusing hydrogen into water. Again, to drink the water, it's another great way to benefit from it. And I saw that you have
I came with mine.
Yes, a hydrogen generating cylinder.
Yes.
That is one of the ways,
But
in the clinical setting, we have a generator, a small machine that people can sit and then apply the cannula. Just the same way that it is done for oxygen.
And they just breathe normally. How long does that take?
Oh no, it can take as long as possible. And then I was going to mention that when we come to whether there are any potential dangers.
Okay.
Hydrogen is so safe.
Right.
And you can breathe it in, inhale it for hours on end without any
No
trouble
problem whatsoever.
Yes.
Okay.
In our practice, the minimum people do is about an hour.
Okay.
Okay, but people can do it all overnight.
I see. While they're sleeping?
While they're sleeping.
Really?
Yes, and by the time they wake up, the difference is clear.
Okay.
Yeah.
Okay.
Also, one other way that you gain hydrogen down, they have made hydrogen tablets.
Oh, really?
Oh, yes. There are hydrogen tablets that you can drop into your bottle of water, and it will bubble, dissolve, and then you drink the water. That's another way.
Wow.
You can apply a hydrogen therapy device on a place where there is pain.
Like joints,
arthritis,
right,
or even wounds or whatever.
Okay.
And it will be absorbed through the skin. And then the pain will go away.
Wow.
Well, we've seen that happen in our practice. Yeah, you can also fill a bathtub with water and infuse hydrogen into it, and someone will soak in it.
Inside the bath.
Yeah. It brings a whole lot of healing and cleansing and detoxification.
So many routes of administration.
So many routes. Okay?
Right.
Even now, I hear of a company that is researching on infusing hydrogen into saline.
Okay.
Saline drip and run it as
a application.
Yeah.
Really? Just like ozone?
Yeah. We're in touch with that company, and we are hoping that when the research is through, we might be one of the first to start doing that.
Oh, great.
So there are really many routes of application.
Okay.
Yes.
So what benefits then can someone derive by utilizing any of these methods of application? What benefits?
So much. First of all, the first thing that hydrogen does in the body is that it modulates the antioxidant effect in the body. Okay, one of the worst enemies of the body is the free radicals, and especially the one called the hydroxyl free radical.
Right.
It's OH.
Okay.
So when hydrogen gets in, hydrogen has a way of targeting the very free radicals that destroy the body, especially the hydroxyl free radical.
And it combines with it and forms
water,
H2O.
Yes.
Right.
Which is normal to the body.
Amen. Good.
So hydrogen modulates inflammation also.
Okay.
Helps the body to bring down inflammation. It can also help in boosting the immune system. Okay. Yeah. It can help in managing cytokine storm.
Really?
Oh, yeah.
That will help with COVID then.
Exactly. Of course.
Because the cytokine storm is one of those things that typically, complicates matters for those with COVID infection.
Exactly.
So if anything can modulate
it,
then that should be a very good protocol.
It is. It is. Yes. So these are some of the ways, like I have mentioned, it can remove pain.
Right.
Okay. So if you apply a device that is releasing hydrogen at a point where there is pain,
the pain
will just go away.
Does it help with people with terminal cancer cases that have extreme pains?
Exactly. It can help with that.
Okay.
And of course, it does also much more to those cancer patients
than just pain management. Okay.
Of course, if you bring down inflammation in a cancer patient, you're already on the way to healing.
Right.
If you boost the immune system, you're already on the way to healing.
Right.
It can energize, it can increase the energy levels.
Okay.
It just gets the patient on the way to wellness.
Right.
Hydrogen has a whole tremendous applications and benefits to both the ordinary person and to the sick person who is not sick, and to the sick person.
Right. So it can be used prophylactically.
Exactly.
Right.
It is.
Okay. Now, when we talk about remedies or protocols or different things to treat people, we always look at number one, the effectiveness of that thing, and number two, the safety of that thing.
Yeah.
You've talked about effectiveness now.
Yes.
What about the safety side?
Absolutely safe. Hydrogen is one of those most, elements in therapies that could be regarded as very safe. Very safe. That's why I said that one can inhale, for as
Non-stop.
much as, in fact, the machine that I have 2 of them. You can turn it to a side where it will stay on permanently.
Right.
Okay, but you can also turn it to a side where it will time itself.
Okay.
And so it is very safe.
Okay.
And there cannot be an overdose.
So you've never seen any adverse reaction in your practice
Not at all.
for anybody using hydrogen therapy?
Not at all. Not even when you apply it on the eyes. I mean, I apply hydrogen on my eyes, and I've had.
Why do you apply to the eyes?
Oh, for any eye ailments,
Okay.
any kind of eye ailment. Glaucoma, cataract,
retina detachment, macular
problems.
degeneration.
Exactly, all those kind of things.
Okay.
I had a lady come who said, when she looks at an object, it will appear like 6. So she came and started using our hydrogen because we have a goggle.
Okay.
Yeah,
for the eyes.
that can connect hydrogen to the eyes, and
Amazing.
she was coming every now and then to use it. Right now, she says, she could see one object.
So 6 has reduced to 1.
Yes.
How long did it take?
Now that's a little bit of a difficult thing to estimate because she actually lives in Abeokuta.
Okay.
So, but she also has a house in Lagos.
Okay.
So she only comes to us when she's in Lagos.
Okay.
So we couldn't actually estimate if she was coming consistently, how long it would have taken.
Right.
And of course, she wasn't coming every day.
Right.
Yeah. So it doesn't have to be an everyday therapy.
Okay.
One of the benefits of gas therapies like ozone and the rest of them, you don't have to do them every day.
Okay.
And wherever you stop, when you come back, most likely it will just continues.
Okay.
So the benefit remains. It's sustained for quite a while.
Now, it's amazing and quite interesting. I'm intrigued, but the issue, the question on my mind is, if hydrogen is this safe and this effective, both for therapeutic and prophylactic applications, maybe for geriatric applications as well.
Of course.
The question on my mind is, why then is it not commonplace in every clinic? Why the hesitation in the deployment of this therapy everywhere?
Okay.
Why is it not common?
Pastor Tony,
is it that it is very expensive that people can't afford it?
It couldn't be more expensive than than some of the surgeries that people go to have.
Wow. Okay. Tell us, please tell us.
If you remember at the beginning, I said that ignorance is the worst disease.
Yeah.
Yeah. So, and medicine has evolved over the years. But the unfortunate thing is that the allopathic, the orthodox medical training, has not equally evolved in the same dimension.
Okay.
There's still a lot of narrow-mindedness.
Say that again.
Yeah. In the patterns of training and applications of health. Health is going into dimensions. I'm sure one of these days you'll be talking about frequencies, to people. So there are so many other ways to bring health and healing and wellness to people beyond pharmaceutical drugs, surgery.
Cut, burn, and poison.
If only people know that there are safe ways that you can take in, what will bring you health and healing, instead of going for some of those applications. I can't remember the last time I put a drug into myself.
Wow.
Or even any member of my family.
As a medical doctor?
Oh, no. Hardly ever. Yeah. So, these, why is it not commonplace?
Yeah.
I say, of course, it's ignorance. Because if the medical world know, hydrogen would be one of the mainstay of clinical therapeutic protocols, even in the emergency room. Okay, one doctor in Brazil, Dr. Sarkos, speaks a whole lot about this. Encouraging medical organizations to put hydrogen as part of the emergency things in the
emergency room.
Because it can really do a whole lot. Yes,
Good. So, what you have said is that number one, it's effective. Number two, it is safe.
Safe.
And I will assume that you're also saying it is affordable.
It is affordable. Yeah, it is affordable. I mean,
you don't have to be a celebrity to be able to use it.
Not at all. And even to own it in your own
Oh,
home.
so you can actually own this device in your house.
Well, the first thing is that you own one already.
Now, this one is the one for infusing hydrogen into water.
Into water.
Okay, but what about the inhalation one?
Even in the inhalation, you can own it. I mean, with probably a little over $2,000, one can own a good hydrogen machine in the house. Home. Yes.
And you don't need any kind of expertise to be able to operate it.
No, not at all. The most of the companies that make them will give you video.
Okay, for your training, for your personal training.
There's not a training. If you watch those videos,
where's the form of training?
Exactly, just plug it and
see
begin
it
to
and
use
then
it.
Repeat it.
Exactly.
Okay.
Yeah.
You've mentioned the cost. Is that the average cost? $2,000 US?
That's for the machines.
Okay.
Okay.
Then you need the supplies. Do you need any kind of supply?
No kind of supplies that are needed to operate the machine.
Okay.
But you might need a little bit of supply to clean the machine.
Okay.
Okay. Most of those machines will require some cleaning.
Okay.
After you have used them for some time. Right. But if you're using it at home, it will take quite some time.
Okay.
But in the clinical practice, where we have a lot of clients come to use it, so we get to clean it like every 2 to 3 months.
Okay.
We clean it so that it will perform optimally again.
Okay.
Yeah.
What about the accessories? That's like if I come to your clinic now, I wear a cannula to inhale the gas.
Yeah.
Definitely, it's not that same cannula you're going to use for the next patient.
Definitely not.
So I believe those are consumables.
Yes.
Cannulas
are, they cost next to
peanuts.
nothing. Yeah.
Okay.
One thing I must say at this point is for people to learn that, quite unlike what people think, the so-called alternative medicine, it's actually cheaper. Okay, when applied properly.
Okay, and
timely, very important, because people here, a lot of people wait until they are sick before they seek medical attention. But if you learn to do things prophylactically, okay, you find that your health will remain with you, and you will never have need for the cut and the burn
and poison.
And the poison.
I've never done hydrogen in inhalation. I've done hydrogen water. I mean, I drink hydrogen water regularly.
Yes.
But I definitely will come to your clinic to inhale some hydrogen.
Exactly.
Very, very soon. Expect me there.
Sure.
All right.
We'll be glad to have
you.
Now,
because of our time, they've been signaling me. We need to begin to tie this up. It's very interesting.
Yeah.
Really. I want us to talk to us about what you imagine the future of hydrogen therapy would be in medical practice. Is there any hope that the sentiment and the paradigm will shift in favor of this very affordable, effective, and safe therapy?
One can only but pray that it happens, because that if it happens, we will see better results with a lot of illnesses. You have seen, time has not permitted us to actually go into specifics.
Maybe you can take a moment
to talk about that, because you can use hydrogen can be part of the protocol you can use to reverse diabetes.
Diabetes?
I'm telling you.
Just by inhalation?
By inhalation and drinking the water.
Drinking the water. So you would suggest that every diabetic patient
should have something like this. Yes.
In addition to coming to inhale the gas, or maybe own one at home.
Own one at home.
Right.
It could.
So what does it do for the diabetic?
A whole lot. Exactly what does the diabetic want? This is the question I always ask yourself. You want to be healed. You want blood sugar to go down. You want to begin
insulin production.
Yes.
Blood sugar management. Insulin sensitivity.
Exactly.
Right.
All those things to come down and to become normal.
Right.
Okay. Of course, it won't happen in one day.
Okay.
This is some of the negatives that people expect things to happen in
if symptoms persist after 3 days.
Exactly. But in functional medicine, what those gadgets are trying to do is to get the organs of the body to start functioning optimally again.
Recalibrating.
Exactly. In fact, that's the word. So for that to happen, that will take some time.
Right.
It didn't take a short time to produce the negative.
Okay.
So it will also take some time to reverse the situation back to normal. But whether it is possible, it is very possible.
Can you just name maybe 10 conditions? You've mentioned diabetes, 9 more.
Okay, I mean, wound healing.
Wound healing.
Arthritis.
Arthritis.
Okay, I've mentioned eye problems.
Eye problems.
Okay, even skin problems.
Skin problems.
Yeah, cancer.
Cancer.
Okay, now I must say something about cancer. We're not saying that with hydrogen therapy alone, you cure your cancer.
We have always emphasized that
it
it
has
is
to
not
be an
a
adjuvant.
single therapy.
It's not single therapy. Okay, so where did we stop?
Cancer.
Yeah, high blood pressure.
High blood pressure.
Of course, now the foundation of them all, inflammation.
Inflammation, okay.
Inflammation is something that,
Right.
okay, there's a whole lot.
Neurological?
Neurological, yes.
What about mental health?
Yeah, because the hydrogen goes through the blood-brain barrier and goes to the brain.
Really?
Yes.
Really? Right.
And that can help a whole lot with that area.
With the brain. Okay,
Yes.
so that should influence mental health too.
Exactly. It
Things
does.
like anxiety,
depression,
yes,
bipolar, and stuff
schizophrenia.
Like that. Yes, it will help in that area. Okay.
Wow.
Yes.
God, give me money to buy my own, my own device.
Honestly.
Good.
Oh, yeah.
So go ahead and talk about the future of hydrogen therapy.
So I am really, really one of those praying that the medical community will be more open.
Right.
Because that if hydrogen machines are deployed to hospitals, we will see a whole lot of difference in medical results. And I believe that as time goes on, that
it will be embraced.
It will be embraced,
yeah,
and incorporated, just like the other gas therapies also.
Right. I mean, oxygen has come to stay in orthodox medicine.
Exactly.
They apply it, the ones we are still anticipating will come on board. Ozone, hydrogen,
and even sometimes carbon dioxide.
Yeah. I've been reading about carbon dioxide lately. The mindset we've always had is that it's a waste product.
Exactly.
Right.
That's the thing.
But lately I started studying and understanding that it could have medical application as well.
It is.
So it's amazing what God has given to humanity.
Honestly.
In nature. To deploy for our own benefits.
Exactly.
But sometimes we develop sentiments against the very things that God has given to us so free of charge.
Yes.
Anyway, our time is up. We have overshot. So please tell us about your clinic. What's the name of your clinic, your address, your website, your telephone contact, in case any of our viewers just want to get in touch with you. I know you're in Lagos, so let us know.
Well, we are located in Yaba at
McNeil.
number 5 McNeil Road.
Yaba.
Right. It's off Commercial Avenue.
That's a very popular area of Yaba, Sabo Yaba
area. Okay. So
Lagos, Nigeria.
Yes. Our website is, of course, DHS Clinics.
www.dhsclinics.com.
Yes. But right now, we had a problem with a site.
Okay.
So it's been under reconstruction.
Okay.
We're hoping that very soon it will come back alive. Email address, of course, rather that for now, they use my personal email.
Okay.
It's Dr. as in doctor, SAM, which is the short form of my name.
Dr. Sam.
Dr. Sam.
Okay.
Then my last name.
Asomugha.
ASOMUGHA at gmail.com.
Okay, Dr. Sam Asomugha at gmail.com. Of course, they would put it on the screen now.
Yes, okay. Right. So with that, we'll be
available. People can contact you.
Yes.
All right. Yeah. Now, apart from hydrogen therapy, as we close, what other forms of therapies do you have in your clinic?
Okay, we offer ozone therapy.
Ozone therapy as well?
In fact, a wide range of ozone therapy.
Okay. I understand there are about 23 routes of administration for ozone.
There are so many routes of administration.
Okay. Direct
intravenous, which is the one we major in.
Okay.
Because that it is about the most cost effective.
Okay.
When in terms of cost and effectiveness.
Okay.
So we offer that. And then, but of course, we do other
The
things
saline
like
one too.
the saline.
Okay.
We run it as a drip.
Okay.
Okay. We offer rectal insufflation.
Okay.
Vaginal insufflation.
Okay.
We offer ear insufflation.
Okay.
Yeah. Okay. We also drink ozone water.
Okay.
Yeah. So, well, what other ones? We also even apply ozone through the skin.
Okay.
We do what is called ozone bagging.
Okay.
Yeah, for wounds.
For wounds.
Like diabetic wounds.
Right.
Yeah. So we do all that, and we found them very, very effective.
Okay.
We do something we call prostate ozone injection.
Really?
Yeah.
For prostate enlargement?
For prostate enlargement, for prostate cancer.
Prostate cancer.
Yes.
How effective has that been?
Oh, very effective.
You just inject into the prostate?
Yes.
Wow.
But you have to be trained to do that. But
Right.
we do it.
Okay.
Okay. At least we've had a couple of men come and
their
receive
PSA
that.
will crash?
Yes, it will go down. Of course, it
Does it
doesn't
shrink?
happen
Does it
one
shrink
day.
the
It helps
prostate itself?
prostate to shrink.
Okay.
Yes, it helps prostate to shrink. Okay. Again, like I said, I don't like believing giving anybody false hope.
Right.
It does not happen in one day.
Okay.
So you have to come
Over and over.
Over.
For how long?
oftentimes not long. You know,
Okay.
probably 3 or 4 shots,
Ah.
you know, could produce results.
Okay.
But of course, you need to add other
Lifestyle changes,
lifestyle
maybe
changes.
supplements.
Exactly.
Right.
And, you know, dietary
Okay.
and all that.
Okay.
You know, so we do all that.
Right. So thank you very much, Dr. Sam, for such a wonderful time. We apologize that we overshot
Shot the time.
today.
There's so much to talk about.
Yes, it becomes necessary to do so because we don't want you to miss out on anything. Thank you for spending your beautiful Monday evening with us. This beautiful Monday, October 24, 2022, 8 p.m. Nigerian time till now. For those who might have missed this, maybe you can send a video to them after so that they can enjoy it. This is something that people need to hear because there are new layers, new additions, new pieces of information always coming to us for our benefits all the time. Don't forget that what we need is not more medication, but more education for what we need. The best prescription, rather, is education. Or knowledge.
Yes.
Thank you once again. Have a beautiful week ahead of you. See you same time, same platform next week. And in case you are yet to subscribe, so easy. You'll see subscribe right below this video. Just click on that subscribe and that's it. Then there's a bell that you ring. Magong, magong. That's the shape of that bell. That's called the notification bell. If you're watching us on YouTube, just click on that bell. Next time your phone, your iPad or your laptop or your desktop will notify you as soon as we come live so that you don't miss any episode again. And if you're following us on Facebook, just like us on Facebook and that's it. And anytime we come live, you can always be notified. Thank you once again. God bless you.
Discover fundamental truth that will transform your health and empower you to live a life void of sicknesses in this new book by Reverend Tony Akinyemi, Nature versus Nurture. Get a copy to experience it for yourself. Please visit TSS Bookshop now to grab a copy. Have you been through stuffs and you survived? Guess what? It's time to set your world on fire. You never know who needs your light, your warmth, and courage. You are a survivor, and that's amazing. I Am a Survivor is Reverend Tony Akinyemi's newest book. Hurry now, grab a copy from the TSS bookstore.